have never heard of hydrocephalus, and if you have, you probably heard the phrase waterhead baby. Hydrocephalus can be a life-changing disorder, or in some cases, the child can live a normal life. Hydrocephalus is not a well-known disorder, and the Hydrocephalus Association website states that statistics show that there are over 1 million people in the United States today living with hydrocephalus. Hydrocephalus is also the most common reason for brain surgery in children. I was diagnosed with hydrocephalus at 2 months of age, and I had a VP shunt placed in at 4 months in order to drain the excess fluid off of my brain into my abdomen. Over the years, my family and I have done research to find out more about hydrocephalus. I want to inform you about hydrocephalus, the classifications and causes, treatments, and the symptoms and malfunctions that all go along with hydrocephalus. The word hydrocephalus is derived from 2 Greek words, hydro meaning water and cephalus meaning head. Hydrocephalus occurs when there is an imbalance between the fluid being produced and the rate in which the fluid is being absorbed. The fluid is called cerebrospinal fluid and is produced in the ventricles and is absorbed in the bloodstream. CSF surrounds the brain and spinal cord and acts as a protective covering during an injury. Hydrocephalus has several classifications and a few causes, which are still being researched. There are 4 different classifications of hydrocephalus that are being researched today. Congenital hydrocephalus is present at birth and can be monitored through ultrasounds during the pregnancy. Compensated hydrocephalus is diagnosed in adults, but studies show that hydrocephalus could be in the body since birth but never cause problems. Acquired hydrocephalus develops after birth due to a traumatic head injury, and normal pressure hydrocephalus occurs in adults, and it is where the ventricles are enlarged but little pressure is applied. There are a few things that researchers believe could cause hydrocephalus, but one thing you need to know is that the causes for hydrocephalus are still not well understood. So some of the causes being researched are genetic abnormalities, developmental disorders, tumors, and traumatic head injuries. Before you gain knowledge of the classification of hydrocephalus, you must first be diagnosed and know some of the treatments. Diagnosis and treatments are well known and well researched. Although there is no known way to prevent or cure hydrocephalus, the only treatment is surgery. There are a couple of ways in which hydrocephalus can be diagnosed. An image of the brain can be identified if the ventricles are enlarged. One would have to have a CT or MRI in order to get the images. Clinical exams could be used to diagnose the patient. Within a clinical exam, there could be an interview and/or a physical neurological examination. A CSF test can be completed to find out if the shunt is responsive or determine the pressure of the shunt. The only treatment for hydrocephalus is brain surgery, which includes a shunt placement. A shunt is a flexible tube which is placed into the ventricular system of the brain. This tube will allow the flow of CSF into regions of the body where it can be absorbed. In my case, the fluid is sent into my abdomen. Symptoms of hydrocephalus and malfunctions of a shunt are something that is drilled over and over again for someone living with hydrocephalus. Symptoms vary with age, but there are still similar symptoms between the two. Symptoms in infants and children are more noticeable than one would think. Some of the symptoms are a larger head than normal, excessive sleeping, vomiting and irritability, chronic headache and vision problems, and a tense, bulging fontanelle. Adult hydrocephalus is often mistaken for other problems because it has a very common symptoms. Some of the symptoms for adults include difficulty walking and staying balanced, cognitive challenges, incontinence, and chronic headaches. A shunt malfunction is where there is partial or complete blockage of the shunt that causes it not to work well if it even works at all. Shunt malfunctions can even be caused by one's own bacterial organisms. Symptoms of a shunt malfunction can include low-grade fever, sore neck and shoulder, redness along the shunt path, headaches, nausea, and the inability to remain balanced, as well as irritability. Hydrocephalus is where there is excess fluid around the brain and begins to put pressure on the ventricles. This problem affects people all over the world. We have learned today what hydrocephalus is, classifications, treatments, and symptoms of this disorder. I hope you are able to leave today with more knowledge about hydrocephalus.